unfortunately, with the technical glitches and a little bit of power outages and internet going down, we're having some issues, but we're so excited to be here today to talk a little bit about what is occupational therapy. And I know there's only a few participants, but we're going to go ahead and start this anyway with a little word cloud just to get an idea of what you already know about occupational therapy, and then we can talk about that. So here is the link. If you can go to that link and start typing in what you think occupational therapy is, or what are occupations, and there's some prompts there. I'll bring you to the screen. Yeah, fellow classmates, you can start typing in a few things as well, just to keep it going. Jobs, yeah, we hear that a lot, that occupational therapist helps get people jobs, and then it's all about career advancement and careers or professions. Oh, basket weaving, I like that. That's new. Yeah, basket weaving. You can see in the picture that they're weaving like PT, huh? Like physical therapy. Yeah, we get that a lot too. Any other final thoughts, and then we'll move back to our presentation. Give it a minute. Okay, well, let's go ahead and go back. And let me go ahead and present here. So yeah, so we got a lot of different words about OT. Jobs is a big one. You think that like, oh, people, you're an occupational therapist, you help people get jobs, right? And it's like, no, we don't. We do a lot of other fun stuff. So before we dive into that, we're going to just do a quick intro for all of us here. So I'm just going to say all of us here are San Jose State Occupational Therapy graduate students. We're all in our second year. And we are reaching out to kind of share a little bit more about our profession, who we are, and what occupational therapy is and what we do, and then how we can really work with others in the allied healthcare profession. So I'll go ahead and go first. My name is Shiana. I love OT because it is a super creative field. We really reach out to people and like problem solve in a very creative and unique fashion. And that's why I really love it. And I'm really excited to work with, potentially work with people with physical disabilities.
Hi, I'm Annie. I also love OT because I've always been really interested in working in a hospital setting, but I also wanted to do something that was also creative. And I've always been really interested in working with people who have had like spinal cord injuries or anything having to do with the brain. So that's what I'm here for.
Hi, I'm Stephanie. So why I really love OT is that it's super creative. You can be artistic, but it's also very science-based. So it's a good mix of the two. And there are a lot of options in the field, which I really like as well. Some areas I'm really interested in are, I would love to specialize in hand therapy, Also interested in nature-based therapy and the mental health aspect of it. And yeah, thanks for being here.
Hey everyone, I'm Sean. I love OT for a couple of reasons. One, I love how inclusive it is for pretty much all ages across the lifespan, and there's so many broad areas you can help people out in. And kind of related to that, I love the occupation-based part of it, which we'll get into shortly. But I like how client-centered it is, and how we can help people out to do the things they want to do and need to do every day.
Hi, I'm Victoria. So why I love OT is I love how holistic it is. It treats the whole person, not just, parts of it. And well, what I would like to pursue or kind of discover more in this field is, well, hand therapy and animal assisted therapy.
So I wanted to go on and tell a story. I recently heard a podcast about a mom's journey, learning that her new baby had a serious medical condition. I'm going to share a little bit of what she said as it relates to this profession. Her child was diagnosed with a rare disease, so rare only 30 cases were documented in the world. After an intensive hospitalization, this family started receiving early interventions. So early interventions are for children 0 to 3 and are made up of a team of therapists, a trifecta of SLP, PT, and OT. So that's speech, physical therapy, and occupational therapy. This rehab team often works together, overlapping and supporting each other for the betterment of the client and the families. For this child, an OT worked with him to hold a spoon to encourage hand strength and manipulation in order to feed himself. When he was a little bit older, and despite doubts against his strength, coordination, and agility, an OT worked with him to learn skills to move around in a manual wheelchair, something that his mother thought he would never be able to do. And now, through the perseverance and determination from the child and the OT, as a 4-year-old, he is racing around and doing wheelies in that wheelchair. So for this mom, when asked to describe in one word what occupational therapy is, she said hope. A more broad definition about OT is from the World Federation of Occupational Therapy. And they state that occupational therapy is a client-centered health profession concerned with promoting health and well-being through occupation. And the primary goal of occupational therapy is to enable people to participate in the activities of everyday life. So occupational therapists achieve this outcome by working with people and communities to enhance their ability to engage in the occupations that they want to, need to, or are expected to do, or by modifying the occupation or the environment to better support their occupational engagement. So moving on a little bit about a little more about who we are. So as you'll find out from this presentation, OTs work in a variety of settings and with a variety of populations ranging from birth to old age. Throughout these settings and with each person or group, OTs focus on the client, their individual abilities and disabilities. But more than that, we look at what is important to them and what is motivating to guide their interventions and rehabilitation. So we look at the whole person, not just their disease. We look at their roles, a son, a mother, a grandparent, the stage in life, and their values and goals. We analyze tasks and we break them down into smaller steps, adjusting the demands of the task to meet with the client where they're at. We also look at equipment to enable participation in life as it relates to the person and their needs. So here's that word again, occupations. What are they? In our profession, occupations are not careers, not jobs, but rather an encompassing term for all the things that you do in your life, from eating and bathing to rock climbing or pursuing a college or graduate degree. So basically, occupations are the activities that are essential to everyday life. Generally, we work with people, groups, or populations that experience occupational barriers. And these barriers can be physical or mental that prevent someone from doing their everyday occupations, such as a person who suffered a spinal cord injury and needs to relearn how to get dressed in the morning. And Annie's going to dive into that a little bit in more detail. So for this next bit, we have a video. I do like sharing stories. I feel like it helps get the point across a little bit more clearly. So we're going to go ahead and watch this video of Alistair and his experience with OT.
The difference that occupational therapy has made for Alistair has been really, really good, because it's certainly helped him integrate into school and education a bit better. It focused on developing Alistair's life skills. It focused on his strengths, focused on his interests. But I think the biggest thing of all was the confidence that he gained from learning something, starting to master and hone that skill. That isn't just about bikes. That's a thing that you can apply to your whole life. It's about resilience and trying and not giving up. He's done something for himself, which he loves, and it's allowed him confidence to tackle some difficult things in life. He's not found school easy. He doesn't find socializing and things particularly easy. But because of cycling, he's in a club, he's in a team, he's with people. He develops a relationship with coaches, a sense of humor, which he finds difficult with other people. So he gets so much out of just that one little thing happening when he was 4 or 5 years old, that his life is, it can't be underestimated, the confidence that that's built into his life.
The thing that stands out for me in terms of occupational therapy and it being different to other medical professions is the focus on practical, real life things that make a difference to someone's everyday enjoyment of their life and fulfillment of life. I think Alistair's story shows us that occupational therapy has a key role in helping people achieve their full potential. No matter what the difficulty a person is experiencing, occupational therapy can 99.9% of the time find a way around it, whether it be changing the child or person's ability or changing the task to suit the person. There's always a way, and I think Alistair's a really good example of that. We realised that Alistair had a disability around about the age of 2 when he wasn't talking at the same speed as other 2-year-olds were. But then when he went to nursery, the nursery staff were pretty clear that he wasn't developing in the same way, he wasn't engaging in play and just general learning and development in the same way as his peers. And so at that point we knew that there was something not quite right about how he was developing.
The support that occupational therapy offered Alistair was they asked us if there was any gross kind of motor skill stuff that we would like to practice with him. And that was when my wife and I both decided that we would like him to be able to ride a bicycle. So it was just something to aim for. At that stage, we were not even sure, even with occupational therapy input, could he actually ever ride a bike? But we thought that's a big thing for him to aim for. And as it turned out, it was massively successful, because they managed, and he rode his bike when he was about 5 years old. And it was an incredible thing to see, and that input from somebody else to make it happen for him was brilliant, absolutely brilliant.
I think the benefits of teaching a child to ride a bike are twofold. One, they learn to do the skill, and 2, also riding a bike develops balance. So rather than traditionally teach a child balance skills and hope that they transfer that into practical functional task, as occupational therapists, our key role is to work on the task, and then the fallout will be that their motor skills develop as a result.
It's a difficult question to answer. What would it be like if he didn't have cycling in his life, because he didn't receive help from occupational therapy? I'm not sure what he would be doing, because every minute of every day he talks about bikes. He wants to be on his bike, he wants to be washing a bike, cleaning a bike, doing something with a bike, asking me to buy him something. And I do not know what he would replace that with. The difference that occupational therapy has made to Alistair in his life and his journey is actually huge. I mean, now when you see what he's actually achieved, it's incredible the impact that experience has had, because that is now the thing that really fulfills him in his life. And definitely for us, it feels like that was a really
important and significant intervention. Alistair.
What is unique about occupational therapy is that we are able to take the abilities of a person and assess them properly, and then take the task that they would like to engage in and break both of those down and bridge the gaps between the two, allowing a person to be as independent as they can be and reach their potential. I absolutely love being an occupational therapist 17 years on, because we put the person at the centre and because we help them achieve something that is really meaningful to them, gives us a real sense of satisfaction. I think if I was to speak to Alistair now, first of all, congratulating him on his success with his cycling, but I think thinking about the bigger picture, and I'm growing up into a young adult, it's just keep harnessing whatever drove you as a child to ride your bike and use that to become a young, independent and successful human being.
So occupational therapy is hard to define, but we like it. It's a unique profession that focuses on the client, and what we do doesn't always fit a mold or a formula, but I hope through this presentation you will get an idea of what are occupations and in what settings you may see occupational therapists. And most importantly, I hope we can learn how occupational therapists and other health professionals can work together to best support our clients. So next up is Annie to dive a little deeper into this concept of occupations.
Hey, thank you, Shiana, for that amazing introduction. So in these next few slides, I'm just going to be talking about what exactly the different areas of occupations are. So again, occupations are those activities that are meaningful and important to one's daily routines and habits. So for example, the first area of occupation that I'll talk about are Adls, and that just stands for activities of daily living. So those are generally things that are geared towards taking care of your own body, just to enable basic survival and well-being. So that can include, like in a picture, bathing, showering, but also toileting, dressing, eating, mobility, and hygiene. So all of which are important to daily functioning and routines. And next is Iadl. So that stands for instrumental activities of daily living. So these are things that are activities that support daily life, that are also important in the home and community, but they're generally a little bit more complex. So it might involve someone taking care of others in their life, whether it be in childcare or taking care of parents in older age, even taking care of pets as well. And it can also encompass driving or financial management or home management and meal preparation, and just generally being aware of your home, generally being aware of your safety in the home or in the community. Next is health management, and we'll also talk about that a little bit later, but generally that just can involve having a healthy diet or managing symptoms of a condition or a syndrome or a disease that one might have. And we also have rest and sleep, which is another really important occupation, because we spend probably about 1/3 of our life sleeping, and being able to have a good sleep and rest routine as a daily occupation is really important to just do the things that we need to do in our everyday lives. In the next slide, we also have education. So that's really another important occupation that's especially important for children and even young adults like yourselves. And these are just activities needed for learning and participating in the educational environment. As you can see in this picture, we have an OT supporting children in a classroom setting. And then work. So kind of like what we mentioned in the word cloud earlier, so a lot of us might think this is what we do all day, but I'm just going to read you the definition of what OT consider work. So it's labor or exertion to make, construct, manufacture, form, fashion, or shape objects, to organize, plan, or evaluate services or processes of living or governing, and they can be performed with or without financial reward. So basically, we can help one find work in the OT world, but that's what we define work as. And then we also have play, which is another important occupation, especially in children. And it's essentially any kind of spontaneous or organized activity that provides enjoyment, entertainment, or amusement. And this is also a really big part of children's daily activities and routines. And then last but not least, we have leisure and social participation. So leisure is just basically any kind of non-obligatory activity that's intrinsically motivating, and it's not time that's committed to other occupations such as work, self-care, or sleep. And leisure might look different for everyone. So reading, drawing, painting, or even playing music. And the distinction is that it's just done out of your own will. And then social participation, another really important activity. It's to support desired engagement in the community and family, as well as peers and friends. So even the act of talking to another person is social participation. And then we have Steph, who's going to talk about what these occupations look like in different settings. So take it away.
All right, thank you, Annie. All right, so Annie just laid out the different areas of occupation that we consider in our practice. So now I'll talk about the different settings that we work in. So some common ones where you typically find us are in skilled nursing facilities, in outpatient clinics, in hospitals, in the home, in schools, and out in the community. So we'll talk a little more about what we do in each of these settings. But first, I wanted to mention that there are a number of specializations that we can go into if we choose to, if we'd like to grow our practice. So I'll share a link in the chat if you'd like more information. But yeah, so I'll move on to each of the settings and we'll talk a little bit about each one. Next slide, please. Thank you. All right, so I'll start with the outpatient clinic. So here we focus on developing, rehabilitating, and maintaining function. This is not limited to physical function. Here we typically treat clients with orthopedic diagnoses and those who have recently had surgery. Some examples of what we might do here. So if a client came in with carpal tunnel syndrome, we might fabricate a custom wrist splint. For a client with arthritis, we could teach them about pain management. For someone with MS, multiple sclerosis, we could educate them on energy conservation. For a stroke patient whose memory is affected, we could help them develop strategies to compensate for those cognitive impairments. And then for a child with a sensory processing disorder, they could visit a pediatrics clinic to work on sensory integration, which you can see in the image with the child on the swing. It looks really fun, but we're actually doing some work here. So moving on to skilled nursing facility. All right, so here we focus mainly on self-care skills, environmental modifications, and behavioral and mental health issues. There's also a large focus on Iadls. So as Annie mentioned, those are instrumental activities of daily living, which include meal prep and feeding. So one example, if you look at the image on the bottom in the middle, this individual is having trouble grasping a cup of coffee due to decreased hand strength. So an OT could come in and determine if the client needs rehabilitation, such as hand strengthening, or compensatory techniques, such as using an adaptive equipment like a U-cuff. All right, and then onto the hospital. So here our main goal is to increase our clients' independence in ADLs, so activities of daily living. These include dressing, grooming, and feeding, in order to help our clients return to home as soon as possible. This includes evaluating the need for splints, positioning devices, and functional mobility devices. So for example, in acute rehab, if you look at the image on the bottom right, this OT is retraining this individual who recently acquired a spinal cord injury to put on her shoes using a grabber while seated in her new wheelchair. We also provide caregiver training, which includes making sure that the caregivers are prepared both physically and emotionally for the transition. For example, in the NICU, which is the neonatal intensive care unit, we often see infants with congenital cardiac issues, and they often have problems with the suck, swallow, breathe process, meaning they'd have difficulty with feeding. So the OT would work on feeding and swallowing and provide parent training on feeding and swallowing as well. So we'll move to the next slide and talk a little bit about the home environment. Next slide, please. Thank you. All right, so in the home, our main focus is on safety and independent living skills, as well as easing that transition from the hospital to the home. So services here include early intervention, as Shiana mentioned in the beginning, is services for children with disabilities ages 0 to 3. We also see clients experiencing changes that impact their ability to function in the home independently. So if you look at the image in the top left, this woman recently broke her hip due to a fall in the home. So now she's learning how to navigate her home with her new walker and wheelchair. So if you were an OT in this setting, you would come in to modify the environment and recommend adaptations that allow for safe and independent mobility. You might assess the need for reinforcements, such as grab bars in the bathroom, and remove obstacles such as throw rugs to prevent further falls. And you would also educate the family on transfers that pertain to the home environment, because these might look different than the ones completed in the hospital. All right. So we also have the school. Here we focus on making the classroom an inclusive environment that supports students of all abilities. So some of our roles here include helping a child develop self-advocacy and self-determination skills. We also support the transition to adulthood, so that might be higher education, employment, or independent or supported living. And we can also recommend accommodations. So if you look at the top right image, the student with auditory sensory sensitivity has difficulty focusing in their classroom due to excessive noise. So as you can see, the OT recommended noise canceling headphones so the student can better attend in class. Jumping down to the bottom right image. Thank you. So the student has difficulties with handwriting due to poor trunk control. So the OT provided a slant board. A thick binder works just as well to promote better posture, so his handwriting is improving. And then lastly, I'm going to briefly mention the community because Sean will be going into more detail in just a moment. So I'll leave you with one example of a community program created by an OT. Thank you. All right, so this program is called Healing Veterans Through Surfing. So an OT named Carly Rogers created a research study in 2014 and found that high intensity sports can have benefits for those suffering from PTSD and depression. So based on these findings, she created this program that utilizes ocean therapy and surf therapy with the goal of relieving symptoms of PTSD and depression in veterans. So pretty cool. There's a lot that you can do here at the community level, but I'll pass it on to Sean for more details there.
Thanks, Steph. Yeah, so as she mentioned, in this section, I'll just get a little bit more detail about how OT support the community, groups, and populations at large. So these are some key areas that OTs can support community level. So starting from the left, OTs can support accessibility in the community as it relates to ADA compliance and stuff like that. We can also help promote participation in occupations for individuals or communities. And lastly, we can also support community integration. And I'll go ahead and talk about what each of these three things mean. So in terms of accessibility, we're looking at community health and wellness and ways to promote that. And for OTs, kind of our perspective with that is looking at barriers, whether physical or environmental, and figuring out what things are hindering or impeding participation in the daily things that people want to do in the community. So this could be like in the picture on the left there, grocery shopping, or even transportation to work, to school, things like that. So our role with accessibility and promoting community health and wellness is through advocacy and education, not only at home, but also in places like the workplace or other settings that people are interacting in. And then an example of this is working with organizations or systems at the community level to provide occupational therapy interventions and to support participation in occupations for those constituents that the organization serves. So what would that look like? It would look like maybe a fall prevention program in a skilled nursing facility, or it could even be a consulting role for the OT, providing information about ergonomic changes to an assembly line in a workplace, just to increase overall health and safety in that setting. Moving on to participation. So at this level, OTs are kind of looking at communities that may be marginalized. So this may be people with disabilities, homelessness, refugees, and we're talking about occupational deprivation and areas that they're lacking in their lives that they would want to participate more in. And so to do this, an OT can perform a needs assessment or an occupational assessment with the community stakeholders to figure out what areas of occupations that they're kind of lacking in, where they need support. And the OT's role here is to help empower that community and that population to become more integrated into their local society. So things to address with these types of situations are life skills. So psychosocial skills like social and emotional intelligence, as well as self-regulation and building up resilience to deal with the demands and challenges of everyday life as they become integrated into their society. And then also related to that is vocational training, if that's interested to either the homeless clients or anyone else. And then lastly, integration is kind of like a culmination of everything I've talked about. So again, developing social skills or even coping skills to foster health and participation. And then we're also very concerned with balance with our occupation. So it's not filling our whole day with just work and stuff like that, but also exploring leisure opportunities in the community to maintain that balance. So helping community stakeholders identify interests, skills, and activities that they can successfully perform. Routine is also important for occupational therapy in the community. So we want to help structure daily life and roles to help establish one's identity in the community. So it could be with a particular organization or a sporting event or something like that. So again, going back to the client-centered aspect of OT, we're still, even though we're working with the community, we're client-centered in that we're looking at what the individuals or the groups bring to the table in terms of their context, their skills, and their abilities, and kind of seamlessly integrating them into society. And then, as we mentioned before, community also encompasses education and employment opportunities. So looking at the physical and motor components of that, as well as the process skills that are involved, what types of cognitive demands are there, and then not to forget also the social interaction component. So OT can help individuals transition into the community, as well as community populations engage more in the occupations that they're interested in. And lastly, I'll just have, I'll hand it over to Victoria to talk about specifically how OTs support other healthcare providers.
Thanks, Sean. So next, I'll go over how we support other healthcare providers. So next slide, please. So first, of course, how OT support doctors. So we support doctors to help clients transition from hospital to home. So often we do that by evaluating behaviors, lifestyle routines, physical dysfunction, and activity levels. So often the most important is identifying barriers to patients effectively managing their medical condition. This can involve medication management. So by doing so, it can help prevent hospital readmissions, reduce cost, improve outcomes and patient compliance. So, often patients have a long list of medication when they come home. So it's important for them to take the right one during the right time. So we help develop strategies in order for them to do so successfully. Another important part is home assessment and care, which involves in safety. So after going home, how do we keep them safe? Like if you see on the image on the left, perhaps sitting down to conserve energy while chopping food, or using an arm reacher to reach to cabinets so that they don't have to get up and exert that energy, and which can be a fall risk. So our job is to remove or minimize those barriers in order for them to live independently. So we're in the business of supporting the doing. So next slide. What we do is how OTs support nurses is really important as well. So as OTs, we know our clients better because nurses and teach them and we teach clients to be more independent. So nurses provide direct care while OTs assess what activities and roles are most important to the client and find ways to teach them to be independent again and resume living life. We help lessen the chances of readmission to hospital, which in turn lessens the strain on the nursing staff. So in this video, I found, for example, the patients here have Parkinson's disease. So they have unstable arms or upper extremities due to tremor. So they shake a lot. So it makes it hard to hold utensils. In order to be able to feed independently, they need adaptive equipment like the stabilizing spoon to accomplish this. So in this video, you'll see patients using this adaptive equipment.
For people suffering from Parkinson's disease, a disorder of the central nervous system, simply eating a meal can be an ordeal. The most common symptoms of the disease are related to movement. The basic act of getting food from plate to mouth can be difficult and frustrating. But now there might be a solution. Lift Labs, based in San Francisco, California, has developed a small device that tracks and compensates for small vibrations and tremors. Anupam Pathak, the founder and CEO, explains that the technology behind Liftware is similar to the image stabilization feature in high-end cameras.
That's pretty cool, right? So next slide, we're gonna have a quick poll of so we wanna know kind of which major are you in? If you would type in chat really quickly. Oh, kinesiology, cool. Hopefully our presentation kind of converted you to the OT side. So this concludes our session for today. So thank you so much for attending. We would like to thank Hugo for having us today to present about occupational therapy. So he's the academic and health professions advisor at the College of Health and Human Sciences, and he's available for advising.
Yeah,
so yeah.
Thank you all. Yeah, thank you graduate OT students for doing this workshop. I found it very informative, and I know I think I met with Andrea earlier, and I recommend you come to this workshop. But either way, though, if anybody wants to make an appointment with me in the future, the best way to do that is to call our office at 408-924-2910 or 408-924-8601, and somebody will schedule you an appointment with me. We can do, look at the prerequisites, look at, suggest some things you can do for patient care. I'm not like intimately a specialist on occupational, but I know enough to get you like 80% there. And then the next would be to talk with graduate students, go to the Occupational Therapy graduation application workshop that's held every October by Dr. Gigi Smith. And she and I collaborate to organize that workshop as well. She does the presentations, I just send out the emails. Anyways, thank you all again for doing this, and the recording will go out to a lot of students. Thank you so much. Bye-bye now.